So we are moving to the last couple of presentations. As you have seen, we have moved through a process where we have looked into measurement of urban food, urban household food insecurity, and then looked into interurban stunting, and then we've looked into health inequalities, which is basically implementation in specific cities in India. And now we are going to listen to two presentations, one on community's role and the other one on policy implication. And I have the pleasure actually to introduce Dr. Siddharth Agarwal, who was not really introduced at the very beginning. Apologies for that. He's a physician, programmer and researcher with over 26 years of experience in different aspects of public health. He's currently the director of Urban Health Resource Center in India. The floor is yours.
In this presentation, we will share some of the things which we did not go into detail in the other one, which is the similar model of community groups and federations. But the scene here is shifting to the city of the Taj Mahal. So this is Agra. This is the Taj Mahal. Some of you probably have seen it. I know Samuel has seen it a few months ago. And this is Agra in Uttar Pradesh, and Uttar Pradesh also borders Nepal. Agra is the third most populous city of the state of Uttar Pradesh with a population of 1.7 million. It is known for the tourism industry, which is obvious, so hotels, restaurants, guides, tour buses, taxi drivers. But it is also known for the leather industry, handicrafts, marble-related works, metal, electricals, and a few other items that are produced. So it's a fairly active commercial hub, and therefore it attracts a lot of people from nearby villages. And it has a very large proportion of slums and informal settlements. Agra's urban poor struggle to secure the core essentials for living. There are information gaps regarding services and entitlements. There are service coverage gaps. Many slums do not receive the service. The service delivery points are far fewer than required. There is a gap between the provider and the community, which is a common gap. It's not surprising, but it's there also. And among the slum population, the social capital is weak. This is the background of how this program started. The program development was a participatory process during 2004 and 5, and we listed all the slums and plotted them on the map of Agra. We assessed the vulnerability of the slums. We did a baseline survey. We consulted with all stakeholders and developed the strategies. We had UHRC received financial support from the USAID between 2004 and September 2009. And subsequently, we've been working on it ourselves. The core strategy is to identify active women in slums and help them collectivize or organize into women's groups. And we build capacity of these groups, generating awareness and information about schemes, services, entitlements. And these groups then serve as a link between the provider and the remaining community. They also manage collective savings. And we also focus on building organizational capacity among groups. From each of the groups, one democratically elected representative is represented in a higher level group or a congress. And there are 4 such congresses or federations, as the word which is commonly used there, in 4 different clusters of Agra. So here about 50,000 population is covered, and here 70,000. Likewise, the total 177,000 slum population is covered through these 4 federations. These are the names of those federations. They were registered in late 2009 as NGOs. This one is still lagging behind and hopefully should be registered during 2012. The first activity is slum level awareness generation and behavior promotion. As there are quite a few of these types of activities which mobilize the communities to adopt healthy behaviors. And this rally, for example, is against alcoholism and gambling. The second set of activities is to support government and private health camps in the slums. So you can see these health activities going on. Wherever a government provider is available, they take advantage of the government provider. But Agra, there are some deficiencies, so they do have the private doctors also. In 2 clusters, private camps are held on a regular basis, and so we see that during a year, this is actually 18 months, during 18 months in this cluster 20 camps were held, and here 42, because this is a larger population. The third activity is collective petitions to the civic authorities. This is the scanned petition from one slum for a water pipe. So this is a petition, this is the response, a positive response from the civic authority. And you can see that this petition was signed by several people. That is important. The other important thing is that this petition has only one request. A complicated petition with many requests will not yield results. This has a very specific request. It says that this slum does not have a public water connection, please provide us. And they've also suggested a space. And they have also given the telephone number of the contact person, who the authority can contact if they want to understand what to do. Then they also track health coverage. So pregnancy coverage, immunization coverage, family planning also they have begun to track through the efforts of another project in the last year or so. This is collective savings and loans. The women's groups collect about 50 to 100 rupees per person per month. So they had started with 5 rupees or 10 rupees, and at the starting, even deciding that they would save 5 rupees or 10 rupees was a very difficult and complicated task. But today, when the groups form, they graduate to 50 rupees or 100 rupees very quickly, because they have seen quite a few early adopters around them, and they have seen how the families have benefited. So the total, I won't go into the numbers, but as you can see, the total savings are sizable, and they are able to offer quite a few loans. The groups particularly are able to offer about the groups which are in these 2 clusters, about 1,000 loans. So total loans that they have given is 3,235 in the past, I think, 12 months. So this is the way we can assess how poverty is being addressed, because these families used to borrow from professional money lenders before this system was in place. And the professional money lender would just make that family a cyclical debtor for the next generation. 3 federations have set up slum level resource and information centers. This is the inauguration ceremony of one of the information centers. We realized that we could work towards cross-generational positive change. So in the last 18 months, children's groups have been formed. It's a platform where children develop self-confidence and they build themselves as future citizens, responsible citizens, and they are engaged in very interesting activities. They are doing a map for their slum. Basically, they want to identify spaces which they can clear up and use for play. So their purpose is slightly different from the older people, but their energy levels are tremendous. And here this child has developed a small craft where he wants to show the type of school that he would ideally wish to go to, or the type of school that his school should transform to. Here you can see them play. This is a drawing and painting competition. These are all the stimulation activities which are happening. The program monitoring is very similar to Indore, so I will not go into the detail. The cost currently is approximately, it's very low, it's actually 0.03 US dollars per person per month. We are using 177,000 population and the total cost that we are currently spending on this. 2 scenes of positive change. This was a slum. This is the way this child was having a bath. And now you see a small platform and a tap. So this all motivates the women groups and the community groups. This is the road in a slum. A few years ago, the road has improved somewhat. We have a few lessons. Modest grants to federations, we feel, and the help of a mentoring person is a very good approach. Of course, the federation has to be built over time, so that takes a while. So we realize that the process is time consuming, but having applied this in 2 large cities, we feel that it's still something which is worth exploring in other cities and other settings. A key factor for success is that this model has evolved organically. We did not design this in 2005. I did not know in 2005 that this is what I will be presenting at a conference in 2012. This has come up from the evolutionary process and the wisdom of the people. There are encouraging signs of communities moving towards collective confidence and self-reliance. We, however, should acknowledge that this is just the beginning and we do have miles and miles to go before we rest.